So OMT stands for Osteopathic Manipulative Therapies. So we use a hands-on approach to medicine, a physical approach to medicine where we manipulate certain structures of the body from a dysfunctional state to a functional state, which oftentimes reduces pain. And this is very, very common in our practice in pregnancy. Pregnancy causes a lot of changes and variability in the human body. So the first thing you'll notice is you release a hormone called relaxin. Relaxin doesn't only work in female's pelvis, but it goes everywhere and loosens joints. So people will notice they have pain sleeping at night, their shoulders were hurt, their back aches, their neck hurts. And that's generally secondary to relaxin early on in pregnancy because the uterus really is not occupying that much space. As pregnancy progresses, especially into the third trimester, you'll notice that your uterus increases in size and the angles of your back change, such that you increase what's called a lordosis, where your lower back comes out a little bit forward to support the weight that you're gaining, and also the increased size of your belly, which also changes the posture of your upper back and your neck on your shoulder. So it just basically changes your center of gravity. People that have repetitive motion type jobs where they have to sit all day or they have to stand all day, these changes become very, very difficult and very, very painful. The most common complaint that we have during pregnancy is low back pain. And people will come in and describe this sciatica that they've been told that they have, but sciatica refers to a referred pain or a radicular, meaning it's going down a nerve root distribution. Most pregnant women didn't herniate a disc during pregnancy, and sciatica is not the correct term to describe the pain. The low back pain that goes down the leg still is not sciatica in most cases. It's actually a referral pattern from loose ligaments promoted by relaxin. So we use osteopathic manipulation to adjust or to correct dysfunction in the pelvis, in the low back, in the thoracic spine, in the neck, in the head, in the extremities, in order to alleviate some of that pain, pressure, and overall feeling of badness. One other thing we do as far as osteopathic manipulation is we're trained in exercise prescription. So there are several exercises that we can prescribe depending on your specific dysfunction, which is usually focusing on the gluteus medius. So the gluteus medius requires strengthening during pregnancy, and if your back hurts, your brain turns your gluteus medius off, which is kind of counterproductive, and so we give you certain exercises to turn that back on. Sometimes you'll need a support belt, in this case an SI joint belt, sacroiliac belt, which can also be helpful, but osteopathic manipulation is generally okay on its own to get you where you need to be and accomplish your goals. Our goal is not to see you very often. We don't mind seeing you, we enjoy seeing you. However, we know that you have other things to do, so we generally try to get you better in about 3 visits and give you the knowledge that you need in order to correct this underlying dysfunction when you have it, which we find very helpful. So that's how we use osteopathic manipulation during pregnancy. And the next question is it safe to use osteopathic manipulation during pregnancy? Yes, there's been several studies that demonstrate that osteopathic manipulation is fantastic to decrease pain during pregnancy, to improve function, and it has never been associated with like preterm labor or any other bad outcomes in pregnancy. So a lot of people worry about that. But the gentle forces applied during osteopathic manipulation are very tolerable. They're generally not very painful, if at all painful, and most people walk out feeling better than they come in. And the other question is, how often should a patient be treated? Well, I find that about once a week is generally sufficient. Like I said, in 3 visits is what we're shooting for to get you going out the door. And you're welcome to come back if it's still bothering you, but our goal is to promote healing and give you the information you need to kind of take care of this as it comes on. And if it flares, then we're happy to see you back. So as often as you need it, I guess is the answer to that, but our goal is to make that less often or less frequent. One more question, is OMT safe throughout the entire pregnancy? And most definitely, yes. We see people from week 6 all the way through week 41 in some instances. So we can generally help at all stages in pregnancy with osteopathic manipulation.